Good afternoon. Today is March the 8th, and it's now 1:00 p.m. As a quorum of the subcommittee is in attendance, I would like to call to order the meeting of the Central Health Eastern Crescent Subcommittee. First item of business is public communication. We will receive public communication for both the Eastern Crescent Subcommittee and the Strategic Planning Committee meetings before we proceed to the Eastern Crescent Subcommittee meeting. Members of the public who wish to make comments virtually during the public communication portion of the meeting must have registered with Central Health via the online form or by telephone no later than 11:30 a.m. today. Yesenia, did anyone register to make comments for the Eastern Crescent or the Strategic Planning Committee meeting?
Hi, Mr. Chair. We do not have anyone signed up to speak for either meeting.
Okay, thanks very much. Appreciate it.
Thank you.
Before we now proceed to the subcommittee agenda, what I'd like to call upon the CEO to talk a little bit about the report that we'll be receiving today, so it would be helpful to have in context for both committee meetings, the data, the information that we've had. So,
Yes.
Mr. CEO.
Yes, thank you. So members, I'm speaking directly to the agendas for both the subcommittee and the committee agenda. What you see being discussed here today, Eastern Travis County service expansion, then later in the committee, update on the Community Healthcare Initiatives Fund, and also we've got packet but not a presentation for the delivery system reform incentive payment that was pursuant to the Medicaid waiver. All of these things that you're hearing about today are pursuant to resources that this board has provided to us through the budget, and they are pursuant to strategic objectives and priorities as noted in budget resolutions. And some of them go back a ways, as you'll see in the Eastern Travis County. Those projects, after we put in temporary facilities and locations, started on permanent facilities. That goes back a couple of fiscal years. And then the Community Health Initiatives Fund is from a prior year as well. And then, of course, the Delivery System Reform Incentive Payment, or DSRIP, goes back way back. So again, bringing these things back to you to either provide updates or in some cases, make sure that you have the information in your pack in the case of DSRIP as a final closeout, if you will. So that's what we're bringing to you today. Thank you.
And that might be helpful for our new members. Member Kitchen and Member Martin might be joining us at the second meeting. And for the reference, I am not Dr. Brinson. I'm filling in for her. So okay, now we will proceed with the subcommittee agenda. Item 1, review and approve the minutes of the May 11th meeting of the Eastern Crescent Subcommittee. Do I have a member of the member will sit in for our meeting? Go ahead.
You need me to, I move that the subcommittee approve the minutes of the May 11th, 2022 meeting of the Eastern Crescent Subcommittee. And
Yes,
you have
I
to second.
I can second it. Have a second. Any discussion? Not seeing any or hearing any. I move all in favor.
Aye.
All opposed? Any abstaining? Thanks very much. Item 2, review and discuss updates on the Eastern Travis County service expansion. Stephanie McDonald will be presenting.
Chairs, this is really information that you saw at your last meeting with one update that's notable. And we'll go ahead and get to the presentation. And I think it's a little bit early in the day, so we hope that there's more people paying attention. There we go. So I have some really good news. We're making substantial progress in Frisbee Bend. We are currently actually ahead of time the timeline, but we want to be very careful. We are waiting for permanent power from Austin Energy. We got there first, and the way that Judy Fath wrote the rules, we have to pay for all of the poles to get the permanent power to the site. So it's about 16 poles that are coming in from Austin Energy. So we want to make sure that we have permanent power before we invite the public to come to this building. We are still anticipating a late summer, early fall opening. And we want to make sure that we are coordinating with our clinical operator to have the clinical services transition from the current site to this location. So a lot of good progress there.
And for the benefit of, for the benefit of our new member, and she may know, but for those who may be listening, who may not know, actually where this is, Hornsby Bend, can you just remind people where it's located?
Sure, this is it's across the street from Daly Middle School. And if you are 973 and you go towards the south, it is at Gilbert and Sandifer Roads. And it's exciting that there is, we are working on the grounds as well with a crushed granite walking trail and a fitness area and there we go, an inclusive playground. And just so you know, that includes both the adult fitness equipment in the back there and the inclusive playground they feature in the front. We are also installing some benches. As a mom, the benches are important. So really, really excited about this. We want to make sure that before we do any official grand opening, that all the features are already ready for play, right? So we'll get more information about those timelines, but the building may be open and ready for service. And like I said, towards the end of the summer, and we'll of course have services available as soon as we can do that safely.
And just a caveat, this in 78725 zip code.
Correct. Yeah.
And this area has some of the largest populations of inner city Austin who have moved out into this area. So this will impact not only those who have been out there, but also new residents who've moved out into there because of a variety of reasons. So I think that's important. People know that we're addressing those needs as well. So,
correct. In addition to Austin's Colony and many of the subdivisions that are out there, there are a number of communities that are in mobile or modular homes.
right. Exactly.
The Dove Valley Health and Wellness Center update, a little bit further behind on this timeline. We are still working with this contractor. I talked to you a little bit about that at the previous meeting. They will be pouring concrete for the slab very soon, and we expect the slab to be poured and cured before the end of the month. And here's the good news. Today, Mike just signed the closing statement for the purchase of the real property in the Colony Park Master Development Area owned by the city of Austin. As soon as we get an executed document from the title company, we'll release the remainder of the funds that are due to the city. This is really exciting. It's been a number of years of effort to get to this point today. And just so you know, we're working right now. Since we started this project, Central Health has now entered into the practice of medicine, the direct provision of care. So we need to look at the site again, make sure we are evaluating the services. We also will go back to community care, our operational partner, and evaluate the program that we had originally thought would go in the building, the clinical services. I think we just did a solicitation for a general contractor for RZ. So we have another one right ahead of this, which is the construction manager at risk for Hancock, but then we will get the design team solicitation going. It's pretty much done. We just have to make sure that our procurement team isn't overloaded. And then we're starting some discussions around the community engagement strategy, and we'll bring forward a proposal for that to you in the future and hope to have that underway this summer with the community. And our goal is that we are timing this with the city of Austin and some of the infrastructure work that they are doing as part of that Catellis is doing as part of that master developed community. But we are slating a fall 2025 opening of the Health and Wellness Center there. And that is my update. I'm happy to answer any questions.
Any questions? Okay, thanks very much. Just a comment. I'd like to thank you all for the hard work you've done, particularly in those areas. And even though it's taken a while, it's coming to fruition. So thank staff and everyone for the work that they've done in making this a reality. So thanks very much.
Thank you.
Oh, that was quick. So let's go to the next item. Confirm the next Eastern Crescent Subcommittee meeting, date, time, and location. Managers, our next Central Health Eastern Crescent Subcommittee meeting is tentatively scheduled for Wednesday, April 12th, 2023 at 1 p.m. at the Central Health Administrative Offices, 1111 East Cesar Chavez, Austin, Texas, 78702. At this time, I'm ready to accept a motion for adjournment. A motion, do I have a second? A second. Any objections? Any discussion? All in favor? Aye. We consider ourselves adjourned. Thank you. Okay, we'll go right into our next meeting, our strategic planning committee meeting. Good afternoon. It is March the 8th, and it is now 1:12. As a quorum of the committee is in attendance, I would like to call to order the meeting of the Central Health Strategic Planning Committee. As a reminder, some of the committee members may be participating by video conferences. So the staff will be managing video and audio feed for all participants closely to make sure we have a legally compliant meeting at all times. We will now proceed to the committee agenda. Let's review and approve the minutes of the February the 8th, 2023 meeting of Strategic Planning Committee. I have a motion.
February 8th, 2023 meeting of the Strategic Planning Committee.
Second. Any discussion? Not having any discussion, all in favor, say aye.
Aye.
All opposed, nay. Any abstention? Not seeing any, we'll move to our next item. Receive an update on the Central Health Community Health Care Initiative Fund. Chief Megan Cermak will be presenting. Megan.
Hi, good afternoon.
Afternoon.
Happy International Women's Day. I'm Megan Cermak. I'm the Director of Public Health Strategy, Policy, and Disaster Response. And I would like to provide a brief update on the Community Healthcare Initiative Fund, or the CHIF pilot program. This pilot has the intent of connecting Central Health with some of the local community-based organizations and nonprofits who are working in the social determinants of health / social services arena, serving the same Travis County residents with low income that we do, and in ways that address the gaps that were identified in our healthcare equity plan. In this first iteration of the pilot, we are focusing on the umbrella area of wellness and prevention. We have 3 awardees that were selected for the pilot, and that includes Austin Voices for Education and Youth, Common Threads, and Health Alliance for Austin Musicians. The first awardee is Austin Voices. They have a long established relationship with the underserved schools here in Travis County. Every year they send out a needs assessment asking families about any unmet needs regarding health, food, housing, and education. They do that through the students and the take-home backpacks. And then staff from Austin Voices, which includes their promotores, their call center, their COVID hotline, and staff at 6 family resource centers, connect back to any families who have identified an unmet need. The contract that we have with Austin Voices, which the total amount is $182,400, is to bolster their presence in 18 schools along the I-35 corridor and in the Eastern Travis County Crescent. Their intent is to reach a total of 11,469 students, and they generally have an 80 to 90% response rate on those surveys. They kicked off their work. I'm sorry.
Yeah, I think it would be good if we wake up.
They kicked off their work in December, and between December and January, they saw a total of 1,573 unduplicated clients. They had an average success rate of 97.5% in meeting the identified unmet needs with families. And most of that work was done at Burnett, Dobie, Houston, Martin, Navarro, and Webb Family Resource Centers and through their call center. The next awardee is HAM. They are partnering with us to lift a new peer-developed health promotion program called, this is a mouthful, Austin Musician Prevention, Education, and Direction, or AMPT for Better Health. And this is a program to expand chronic disease education, prevention, and navigation services. Not all of the HAM members will be eligible to participate in AMPT, only those who are at or below 200% FPL. That brings a total of about 1,332 eligible participants. There are 3 pillars of this peer-developed health promotion program. The first is getting eligible participants to participate in more preventative screenings and increase vaccine uptake. The second is improving health literacy, and third is providing some direct navigation services. And their total contract is $166,190. They also kicked off in December, and as of January, they reported that 100% of those eligible to participate in the program have completed their health survey. And that health survey, again, is to inform musicians to bolster their participation in preventative screenings and vaccines. And then we have a third awardee, which is Common Threads. And we're partnering with them to provide SNAP-Ed approved cooking and nutrition education programs. They have also 3 pillars of their work. Some of the nutrition education will be delivered in underserved schools, some in our affiliated health centers, and then some in family resource centers and community centers. You can see here the full menu of curriculum and activities that they have planned, and their total contract amount is $200,000. The objective of their program is to implement 140 program sessions, reach 2,040 Travis County residents, 825 of those being youth, 415 of those being adults. They'll serve 12,500 participant-made, healthy-made meals and snacks, and deliver over 14,000 hours of nutrition education. That's a wrap up of the 3 awardees. Before we move on to next steps, I know that we have new committee members, so I just want to draw your attention to some historical documents that are included in the board packet. The first one is, well, it's not historical, but it's a demographic breakdown of all the clientele that will be served by the 3 awardees. And then the historical documents include the procurement process that we follow, the timeline, and the announcement of the awards. Okay, our next steps include, we have a contract manager assigned to the 3 awardees. They had to provide some pretty heavy technical assistance in the beginning to get the contracts up and going, to make sure that we're getting the data that we need from them, in addition to some qualitative information. That technical assistance will be provided throughout the course of the contract. We also get the 3 awardees together as a cohort. We did at the beginning in December at the launch. And then we have our first Q1 cohort meeting coming up in a couple weeks. At the first cohort meeting, we'll focus on program enrollment and launching. And then the subsequent cohort meetings will focus on implementing the program and member retention. Finally, we're using these first couple of months to make sure that as the data is rolling in, we can set up our evaluation framework, and then use that to look at the success of the 3 individual projects and then the CHIF pilot as in its entirety. Okay, I'm happy to take some questions.
Kitchen.
We'll get this down. Okay. Just a quick question. It may relate to the scope. So in terms of the I think it applies to the AV one.
I'm sorry, to which one?
AV.
Oh, okay, Awesome Voices, got it.
Yeah. So so part of that is referrals. Did I hear you right?
Correct.
Okay. Is there a mechanism to get data about the effectiveness of the referrals?
Ooh, that's a good question. So we're actually working through that right now.
Okay.
So we we think that we can track down if Austin Voices refers specifically, so just internally, if
Yeah.
Austin Voices gives a referral for MAP, we are actually connecting those referrals to MAP enrollment numbers.
Okay. But so if AB refers to someone for housing, for example, or for food services or something like that, is AB set up in their system that they will then know that the person went to the referral and what happened?
Like a closed loop.
Yeah, do they have a closed
Do you
loop?
know what? I can ask that question, but I don't know the answer.
Okay.
Right now, but I'll talk to Julie Weeks and then I can email you.
Yeah, my thought was just if they have that mechanism set up, which, sometimes that can be difficult to set up, but if they have that set up, it might be useful information for us to have, just in terms of, what's actually happening with the referrals.
Right.
So,
We do get the data that the referral happened and that the
oh, you
person.
do get that?
Yes, we do have, so that was that 97.5% success rate, but I
Okay.
think you're asking to go a level deeper.
Yeah.
And was the person actually connected with the resource?
Did the person go to the referral? Did they get some kind of result?
Yeah, I can ask that question.
Okay, thank you.
Thank you, Ms. Sackett.
Thank you. Thank you, Megan. Appreciate it. I'm happy to see that you've awarded great organizations. Hope to do great work. Now, I'm looking at your this page, doesn't have page 39, process highlights.
Yes.
Can you first of all remind me our grant was it $1 million or 800?
800,000 total.
800. Okay. So you received about 6 proposals. That's what it
Lisa
says
Owens
here.
in the room. This was a procurement question. Lisa, do you want to join me?
So I see here that there were 6 proposals received, summer 2022.
Yes.
I'm on the code. Yes,
Alina's on as well.
Oh,
because I
okay.
was on the procurement.
Thank you.
I'm sorry.
How did you, I know this is a procurement question that you determined those are 3 that qualified, but there's additional funding left. So what made you select these 3 and not be able to expand it to other entities? Did they not meet up to your criteria? I'm just curious that we had additional funds allocated. I would love for us to do more. And just what was the reasoning? Thank you.
Yeah, so that's actually not a procurement question. That would have been designed by the evaluation criteria and the program. So I'm not sure how anyone was involved in that, but the procurement evaluation team would have met the requirements of the proposals requirements. So that would have been designed by the programmatic team. What are the evaluation criteria and those decisions at the evaluation committee level? But the procurement process would not.
I'm just curious.
that.
Yes.
Yeah. Yes, go ahead.
If I may. Thank you. So there's really a larger policy issue here. And that when you have an allocation like this and you put out an RFP for competitive contracts, these organizations, they will put together a proposal for which they can responsibly take the investment that we're making and spend those funds and be held accountable and have the deliverables in order to get paid. And so those numbers were what they were. And so, yes, even if you do have funds that are left over, if per the evaluation criteria, it just didn't get to that point where those funds could be awarded, then that's why you have those funds left over. And then part of this also ties back to some board guidance that we got before we went out with the RFP on, what types of projects and programs were you looking for? And so there's a certain, and not to just boil it down to road economic terms, because we're talking about really meeting some unmet social and socioeconomics and humanitarian needs, but it boils it down to what's the price point for those types and scope of projects, if you will. So again, this is kind of some overarching policy comments. It's not really related to the procurement policy per se, or some of the evaluations that were done with respect to the other projects. But I think you'll see this going forward too. If this is something the board chooses to continue, that that's going to happen, especially if you have a competitive procurement process and you're thinking, oh, it's going to be $800,000, but you get 4 proposals at $100,000 each, there's $400,000 worth of proposals. And you can't necessarily compel those presenting to, hey, scale up so we can, provide those funds. So I think this will always be an attribute of these types of programs. But thank you for letting me respond.
Thank you, Chair Jones. Monica Crowley, Chief Strategy and Planning Officer. And if you remember, as a taxing hospital district, subdivision of the state of Texas spending tax dollars, Central Health is not the type of organization that may award grants. So these are not grant awards. We didn't have kind of a dedicated pot of money to allocate to award grants, much like the city or the county would be able to. That's not within the purview or jurisdiction of Central Health, which gets to, I think, Mr. Gieslin's comments is that these are structured as RFPs for proposals for vendors to provide services pursuant to the scope of work and requirements to Ms. Owens' comments as well that were put out in the procurement based upon our healthcare equity plan. So there were identified needs that were put into the procurement. There was an evaluation process. There was a team that came up. There was a potential pot of money that was budgeted that could be used to fund contracts with vendors based upon defined requirements. And then we went through RFP procurement process and then entered into contracts based on the procurements that were awarded based upon that procurement process. So this really isn't a grant awardee type situation. This is an identified set of services that are needed by the organization, and then an RFP that was put out based upon those needs, and then awards awards of contracts that were negotiated with defined deliverables that could be paid for. So even though I know it in the slides, and I've looked at these slides and approved them, but it wasn't until we were sitting here that I thought, oh, we'll talk about award amount. Well, really, technically, the award amount is an NTE that is contracted with the organization that may be met if the organization performs. Not to exceed contract amount. Thank you, Mike. And not to exceed contract amount that may be awarded or that may be paid based upon achieving the deliverables that are identified in the contract. Does that help?
It does. Sorry if I can, one last thing. I know this has been our first round, and has there been any lessons learned that you would like for us to be aware of?
Sure. So the type of data that we need to collect as a healthcare entity is not the type of data that these small CBOs and nonprofits are used to collecting. And so we've had to work closely together to ensure that we can get the meaningful data that we need to make sense of this project, but also not be overburden the small CBOs. And I think we're at a good place. But that was what I was alluding to when I was talking about that heavy technical assistance that was required at the beginning of the contract execution.
Thank you so much.
And I would say another lesson learned is just this delineation between grant and Central Health being a hospital district and not a grant making entity. And just making sure that we're able to delineate that, and also, like you said, without overburdening CBOs with kind of with the process that's required for Central Health to contract with organizations.
I have a question.
Will you go first?
No, you go ahead.
Okay, well, my question was sort of a follow-up on hers. And there's two parts of it. The first part of it is what is y'all's thinking about? There's about 150,000 that was, the not to exceed. And I understand what you're saying, in terms of the difference between a grant. I mean, really what we're doing is contracting for services. But we have about 150,000 that was not allocated. So what is y'all's thinking in terms of the options for using that this year? I'm making an assumption that that was an annual amount. So is it something that would need to be repurposed if it was the thinking to use it for something else? Or are there options, since this is a pilot, if any of these three indicate that they can provide a greater level of services, that we could award more to each one of them? Or what, or is it something that would just have to be redone again in terms of an RFI? I guess what I'm asking is, I hear the concern, and I would have the same concern, because we all know, of course, that there are a lot of needs out there. And there's probably more than 800,000 worth of needs. And so, but, you know, we've got to problem solve for the role that Central Health plays, and the fact that it's not a grant and it's for services. So I'm just wondering, I guess my overarching question is, what are the options with regard to this 150,000?
Sorry, I'll introduce myself this time. Lisa Owens,
Thank you.
Deputy CFO.
Yeah, thank you.
So you'll hear about this in the budgeting process.
Okay,
But we can include that additional funds in next year's budget. But as far as additional awards, that would be driven by another contracting solicitation.
okay,
And correct me if I'm wrong, I believe there is an option based on performance for a second year.
that's correct.
In the contracts. So that would be determined by the program staff in evaluating the availability of funds for next year's budget as well. So I believe these contracts were both one-year contracts with an optional 1 year.
Okay.
renewal.
Mhm.
So I think that has to be taken into consideration as far as what's available and the timing of, if the decision is made by the program staff, the timing of another solicitation. But we will talk about it in the budget process, and those funds could be included.
Is there an option for a mid-year budget amendment that would authorize that not to exceed for, I said, is this the dollar amount for each one of these entities? Is that in their contract and not to exceed?
Yes.
Okay, so is there an option for a mid-year budget amendment that would allow for, now again, this may be something that they can't do. So I may be going down a road that's really not, I mean, they may have really taken on all the capacity that they can. I'm just exploring what kind of options there might be.
That is something that typically with our contract, it's not necessarily a budget amendment process because the dollars have been allocated. Okay, if our contracted providers are doing more than they anticipated or had the sense that they have the capacity and I think it's more if they're kind of butting up against the top
Okay,
of that NTE because they are doing more or hitting more targets than they thought they would, then we could amend the contract with them to expand that. I think also as we're going through the planning process for implementing the healthcare equity plan, I think part of that is also developing this roadmap for social determinants of health and services that social determinants work that it needs to be prioritized to support the implementation of the healthcare equity plan. And I think also as we bring that information back to the board as we go through the budgeting, how as an organization Central Health chooses to purchase and pay for these more social determinants, community outreach, those types of projects is also going to be part of that work as well. So there may be other avenues for contracting for these services as well.
Okay, I just don't, I'm just interested in, to the extent that there's an avenue that that we expend the 150,000 because you know, and not wait because of the kinds of needs that are out there. So just exploring the options, and so I'm hoping that you guys will consider that. You know, if you need to bring it back to the board, you know, in terms of reauthorizing the use of that 150,000 for something else, that's fine. But I would hate to just set it aside and wait for the next year. So
That's a very good point, Manager Kitchen, I agree with you that I'm concerned that we have some, I won't say reserve money, but we have some that we didn't use the year in which we really needed, so.
Yeah.
So, okay, any other questions? I have a couple of just quick ones. One is on the HAM members under 200% of poverty chart by race and ethnicity. I want to make sure I understand this. Are these members who are part of receiving health services through dollars we receive, or are these just members who are part of HAM? What does that chart recommend?
These are HAM members who are part of that AMPed programs.
Okay, so they are actually
They're
receiving.
200% or below, yeah.
Okay. Just one other comment. This is a design. I don't know if it's possible. I think someone looking at this would assume that 72% of the population would be Black because of the color. I don't know if there's any way we could maybe reconsider doing that in another
Okay,
format.
thank you for that. Yes, we can.
Just an observation I'll make. The second question I had relates to the comments you made about us being a hospital district and contracting out versus grant award. Given that we are a enterprise arrangement, are we unique in that, or this the same case for other hospital districts? Are they allowed to contract out the services that they do not provide themselves, or are they restricted because they can't do that for grants as well? They can't provide grants. Did you understand the question? I know
Yeah,
maybe.
so under chapter 281, hospital districts formed under chapter 281. And I'm only commenting on 281. Hospital districts under 281 and cannot provide grants. And actually, this is it's a larger state constitution. David, I'm going to hand it off to you.
She's absolutely right. To answer your larger question, grant making authority is something that has to be very specific and very obvious in your statute. There are very few entities. Most of them are HHS and similar entities that can give grants. But that has to be given very clearly in statute, and it's not in 281.
Okay. All right, then. Thanks very much. That's very helpful. Any other questions? Okay, then. Thanks very much. Let's appreciate it. Item number 3, there was no action needed on that. So item 3, receive an update on the delivery system reform incentive payment disrupt program. Members, there is no presentation on this item. The material are in your meeting backup, and staff can answer any questions of them if you have any at this point in time. If not, we'll proceed to item number 4. I announce that the committee is convening in closed session to discuss. Oh, did I miss something? Oh, okay. I was going to do that at some point. Item number 4, receive and discuss a briefing regarding Seton Family of Hospital and Seton Healthcare Family versus Travis County Healthcare District, DBA Central Health, calls number D1GN230041. And item number 5, receive and discuss a briefing regarding Birch et al. Travis County Healthcare District, DBA Central Health, and Mike Giesland calls number D1GN17-005824 in the 345th District Court of Travis County. I announce that the committee is convening in closed session to discuss agenda item number 4 and 5 under Texas Government Code 551.071. Consult with attorney. It is now 2 o'clock on March the 8th. And we're coming out of the closed session to take up item number 6. Item number 6, confirm the next strategic planning committee meeting date, time, and location. Managers, our next Central Health Strategic Planning Committee meeting is tentatively scheduled on Wednesday, April 12th, 2023 at 1 p.m. or immediately following the Eastern Crescent Subcommittee at the Central Health Administrative Offices, 1111 East Cesar Chavez, Austin, Texas, 78702. At this time, I'm ready to accept a motion for adjournment. I have a motion, I have a second. Second. Any discussion? All in favor, say aye.
Aye.
Any objections or no, or any abstain? Not hearing any, we consider ourselves adjourned.